Let me summarize, Doc, because there's a lot there, and I think it's important that people sort of just hear the summary, and you can just correct me with regards to what you said. Number one, there's no place for a root canal. You're leaving dead tissue in the body that might get triggered years later to cause some serious toxic effects in the body. And it might be a very small infection, but it can lead to things changing in years to come. Is that correct?
Yes, absolutely.
Great. Second, we can get a process called cavitation when we remove teeth. If the procedure isn't done correctly, or osteonecrosis of the bone, and we start getting this cavitation, this osteonecrosis, and this dead tissue of the bone can have systemic effects.
Absolutely.
Great. So if people have removed their wisdoms or they've removed a tooth, what should they do?
Yes, opening the can of worms, the Pandora boxes, going down the rabbit hole. Almost, and this is a very daring statement, okay? But almost everybody who has had a wisdom tooth removed would have osteonecrosis, and of different sizes and severities, but they will, most of us, including myself, would have them. And yes, they need to be clean. So just consider this for a moment. If anywhere else in your body there is necrotic tissue, do you leave it?
No, you don't. No, you don't.
You don't. Any good surgeon would remove whatever needs to be removed. And if for things of life during surgery they see, due to this incision, maybe this tissue will not have proper blood supply. If I close, this tissue might die. If they notice it, they will cut it away because it's easier in that moment than having to open the patient again. So why would we leave that tissue in the mouth? It's like extractions, a normal, simple dental extraction. What were we taught? We do the things that we have to do to remove the tooth. And once the tooth is out, typically and historically, bite this gauze or cotton and off you go. So would you ever leave a clinic if part of your bone is showing anywhere in your body? No way. No way. If it is a terrible open wound, until it is properly fixed, you don't leave the hospital. But now, every single day, gazillions of people go to the dentist somewhere to have a tooth taken out. Before you leave the dentist's office, the bone is soaked in saliva. Now, saliva is either good or is not good. So in nature, we see our beautiful animals licking their wounds and the wounds heal. But we are a particular kind of animal. So our saliva is not necessarily a good saliva for healing because of other issues. So by definition, that bone is already infected. So then you get home, you're thirsty, you're hungry, and very soon you will have organic broccoli in contact with your bone or anything. Tea, coffee, soup, you just name it. That doesn't make sense. And yes, that's what we learned and that's what we did for many years, but it doesn't make sense. So it is very important to cover this wound after scraping the socket properly to prevent infections.